When people hear the word Ebola, it often brings to mind images of deadly outbreaks, strict quarantine measures, and emergency responses. Since it was first identified in 1976, Ebola has caused several outbreaks, primarily in parts of Africa, with fatality rates that can range from 25% to over 80% depending on the strain and available healthcare resources. But what if Ebola were to become a true global pandemic, spreading across multiple continents and infecting millions of people? What would happen and how prepared would the world be? Let's explore this hypothetical scenario. First, it's important to understand why Ebola has not become a pandemic in the way diseases like COVID-19 did. Ebola spreads through direct contact with the blood, body fluids, or tissues of an infected person or animal. Unlike respiratory viruses such as influenza or COVID-19, Ebola does not normally spread efficiently through the air. This limits its ability to move rapidly through large populations. However, if a future strain were somehow to spread more efficiently between humans, the consequences could be severe. One of the biggest concerns would be the disease's high mortality rate. While COVID-19 had a relatively low fatality rate compared to Ebola can kill a significant percentage of infected individuals. A widespread outbreak involving a highly transmissible Ebola strain could place enormous pressure on healthcare systems worldwide. Hospitals would likely become overwhelmed quickly. Ebola patients often require intensive supportive care, including fluid replacement, electrolyte management, and infection control measures. Large numbers of severe cases could rapidly exhaust hospital beds, medical supplies, and healthcare personnel. Healthcare workers would face particular risks. During previous Ebola outbreaks, many doctors, nurses, and support staff became infected while caring for patients. If transmission expanded globally, protecting frontline healthcare workers would become a top priority. Governments would likely implement aggressive public health measures. These could include travel restrictions, quarantine protocols, contact tracing, isolation facilities, border screening programs, emergency public health declarations. Many of these measures were seen during the COVID-19 pandemic, but the response to a highly lethal disease like Ebola could be even more stringent. The economic impact could also be significant. Global supply chains might be disrupted as countries attempt to limit transmission. Industries dependent on travel, tourism, manufacturing, and international trade could experience major slowdowns. Financial markets would likely react to uncertainty, and governments might need to implement large-scale economic support programs. Social and psychological effects would be substantial as well. Fear often spreads faster than disease itself. High mortality rates could increase public anxiety, misinformation, and panic. Clear communication from health authorities would be essential to maintain public trust and encourage evidence-based protective behaviors. On the positive side, the world is far better prepared for Ebola today than it was decades ago. Scientists have developed effective Ebola vaccines and treatments. During recent outbreaks, vaccination campaigns helped control transmission and protect high-risk populations. International organizations, governments, and public health agencies have also gained valuable experience in outbreak detection and emergency response. Modern surveillance systems are capable of identifying outbreaks much earlier than in the past. Rapid diagnostic testing, genomic sequencing, and global disease monitoring networks provide tools that can help contain emerging threats before they spread widely. Organizations such as the World Health Organization, national public health agencies, and international research institutions continuously monitor Ebola outbreaks and work to strengthen preparedness efforts. That said, preparedness is not the same as immunity. A highly transmissible Ebola strain would still present an extraordinary challenge to global health systems. The most likely outcome, however, is that existing surveillance systems, vaccines, treatments, and public health responses would help limit spread far more effectively than in previous decades. If Ebola were to become a global pandemic, the consequences could be serious due to the disease's high mortality rate and the strain it would place on healthcare systems. However, advances in vaccines, treatments, outbreak monitoring, and international coordination mean that the world is considerably better equipped to respond than it once was. While the scenario is concerning, it remains a hypothetical one, and current Ebola transmission patterns make a COVID-style global pandemic less likely than with highly transmissible respiratory viruses.